I'm Dr. Saman Hewamana. I'm a specialist in treating blood-related disorders and blood cancers. I'm going to give you an introduction about a simplified summary about blood cancers. Blood cancers are the cancers coming from blood, bone marrow and lymph nodes. Some people call it leukemia, some people call it bone marrow cancer, some people call it lymph node cancer. It's a collection of cancers coming from blood, bone marrow and lymph nodes. Now, though I told you that blood cancers can come in other organs. Now, for instance, all the cancers coming in thyroid are not thyroid cancers. There's a type of cancer called lymphoma that belongs to blood cancer, which can come in the thyroid. Also, some people get tumors in the brain. It could be a brain cancer or it could be a lymphoma, which is a blood cancer. So, though generally blood cancers come in blood, bone marrow and in lymph nodes, blood cancers can arise in other organs as well. It's important to treat them as blood cancers, not as a cancer arising from the name of that organ. When it comes to treating blood cancers, even before COVID-19 came into play, blood cancer patients had a higher risk of dying from infections. It's very important to keep them separated, not only from other medical patients and also from patients with other cancers. So in developed countries, there are separate hemato-oncology or clinical hematology units where patients with blood cancers are treated separately. Again, when it comes to people who treat blood cancers, this has developed as a separate specialty now. In certain developed countries, there are doctors who specialize into one particular type of blood cancer, but generally there are specialists treating blood cancers. So it's a subspecialty coming from either hematology or from oncology. They are called hemato-oncologists or clinical hematologists. They are the people who treat blood cancers in the developed world. It's very important to have that training because blood cancer is not one thing. There are hundreds of types of blood cancers and the world is changing in cancer care, and every day, every week, every month the treatment protocols change. So to keep up with those changes is important to be reading and also be in one field. We did this couple of educational videos for people to know about blood cancers and not to give up, be positive, and I hope these are helpful in you knowing a little bit about blood cancers. If you have anybody known to you, you might share these videos with them, and I hope this is helpful in education and in getting better survival and coping in blood cancers and development of blood cancer care in Sri Lanka.